Hello everyone and welcome to our group presentation of NNNV 3282 Special Clinic 1 course. We are from Group 5. In this video, we are going to walk you through the protocol in binocular vision assessment. Our lecturer is Dr. Nolaila. These are our group members. What is the purpose of BV Clinic? BV Clinic specializes in binocularity, which is how your two eyes work together. A comprehensive eye examination would be done by qualified eye practitioner to detect any binocular vision anomalies and provide suitable management to the patient. Let's start our video. The patient will enter the optometric clinic and register at the registration counter. The examiner will then lead the patient to the BV clinic. At the same time, the examiner is observing the patient. The procedures that we usually do in the BV clinic are history taking, visual acuity test, refraction, sensory evaluation, motor evaluation, vergence evaluation, and accommodation evaluation. Firstly, the examiner will do history taking. It is to organize the patient's complaint, filter the information, establish a tentative differential diagnosis, as well as build a good rapport between patient and examiner. This is the procedure of history taking. Then, the examiner will take the monocular and binocular VA of the patient at distance and near. This is to assess the visual function by using a measure of the limit of high spatial frequency resolution of the visual system. This is the procedure taking near and distant VA. Next, the examiner will do refraction. There are two types of refraction: objective refraction and subjective refraction. Objective refraction is to determine the refractive status of the patient objectively by using the instruments such as retinoscopes or autorefractors. On the other hand, subjective refraction is to determine the refractive status of the patient subjectively. It provides best VA with accommodation relaxed. These are the steps to carry out objective and subjective refraction. The four tests for sensory evaluation are word for dot, stereopsis, Bartolini lens, and mallet unit. Word for dot test is to assess the patient's degree of binocular vision and check for suppression by showing four lights to patient. The normal value for word for dot test is able to see all four lights. If patient can see all four lights in absence of manifest screen, this means that the patient has normal binocular single vision, good fusion, and no suppression. Stereopsis is to evaluate the patient's level of binocular function and depth of perception. Examples of stereo acuity tests that we use in the BV clinic are Titmus fly test and TNO stereo test. The procedure of doing Titmus fly test and TNO stereo test are shown here. Additional tests can also be done. Additional tests such as Bartolini lens is to determine the direction of a pseudofovea, abnormal retinal correspondence ARC, and suppression. These are the interpretation of patient's response. Mallet unit is then used to detect the fixation disparity that is most likely to occur in the presence of a decompensated heterophoria. This is the procedure to do Maddox unit and its normal value. Then, there are a few tests to evaluate the motor function. First is extraocular motility test. This test is to assess patient's ability to perform conjugate eye movements, and the expected finding is SAFE, which stands for smooth, accurate, full, and extensive. Second is cover test. Cover test is an objective dissociation test to elicit the presence of a manifest or latent deviation. It can be divided into two: cover-uncover test, which is also known as unilateral cover test, and alternating cover test. Cover-uncover test is to distinguish a tropia from a folia, while alternating cover test is to determine the direction and size of the deviation. There is prism cover test, which is also an objective method to measure the size of lateral and vertical folia at distance and near. Additional tests can also be done. Hodgberg test is an alternative procedure for examining ocular alignment under associated conditions. Symmetry is the expected finding for Hodgberg test. Maddox rod is to measure the lateral and vertical folia at distance and near by using subjective method. Next, we proceed to the test for accommodation evaluation. First is the amplitude of accommodation. This test is to measure a patient's ability to change the focus of the eye's crystalline lens in response to a new stimulus in diopters. The expected value can be calculated by using the Hofstadter's formulas. Then is monocular estimated method and EM. It is to measure the accommodative response to the near working distance objectively. The expected finding is plus 0.25 diopter to plus 0.75 diopter lack of accommodation. Relative accommodation test is to give an estimation of the range of accommodation from stimulation and relaxation at a fixed distance. Expecting negative relative accommodation is plus 2 diopter with standard deviation plus minus 0.5. Expected positive relative accommodation is minus 2.37 diopter with standard deviation plus minus 1. Next, accommodative facility test is carried out to measure the patient's ability to make rapid accommodative changes under monocular and binocular conditions. The expected finding for monocular is 11 cycles per minute and binocular is 8 cycles per minute. ACA ratio can be calculated to determine the change in accommodative convergence that occurs when the patient accommodates or relaxes. Normal range of ACA ratio is 2 to 6 prism diopter per diopter. There are some extra notes here. The examiner needs to give appropriate management to the patient depending on the patient's condition. Follow-up appointment need to be scheduled to monitor the patient's condition. As a reminder, before a patient wants to schedule an appointment at our binocular vision clinic, they need to go through a comprehensive eye examination in our clinic first, unless the patient is referred by any optometrist or ophthalmologist. That's all for our video presentation about protocol in preview assessment. Thank you for watching.